What's going on, everyone? This is Attorney Ryan. I'm checking in real quick to make the case for universal health care. This is going to be a quick rebuttal to some points that I got during a debate. I was debating another attorney, and he said that universal health care would be a disaster and it would be the end of America and people would die. He really believed this. I feel very differently, and I want to share those points. But before I get into that, this is my first Substack video. I'm still learning how the tech works, so please bear with me. Also, office is bare bones because I'm building something real special for you guys. Here's my soundproofing phone. I got mics that aren't connected to anything yet. It's a whole project, but I didn't want to wait. Anyway, about the debate. We live in the US of A, greatest nation on earth. And my opponent basically said that we have the best, most advanced healthcare in the world, and we're the envy of the world, and we can't have universal healthcare because a few bad things will happen. First, he says that if you put the government in charge of healthcare, it'll be like having the DMV in charge of healthcare. He thinks wait times will be so long, people will die waiting for care. He thinks that very unqualified sort of DEI type people will be your doctor, so you won't know if you have a good doctor or not. And you won't have good doctors because there won't be a financial incentive. He says doctors won't be paid as well, so you won't get the best people because we all know only the best people work for high paychecks. And then he also raised a concern that I found particularly interesting, which was without benefits, such as healthcare benefits for high-level positions, people won't be motivated to work hard. They won't be motivated to work their way up the corporate ladder to get that sweet, sweet healthcare package that comes with higher roles. I want to talk about all those points. Obviously, I disagree with all of it. So the first point against that, which is in favor of universal healthcare, is fuck you. We're going to start with fuck you because why not start there? Fuck you. Because as humans, as a society, I think there is a moral duty for us to take care of each other. Now, that could be my far left former firefighter propaganda. For those who don't know, I was a firefighter in my community before I was a lawyer. Never once did I step back and think, oh, golly gee whiz, how are we going to pay for all this? That's what your tax revenue is for. Living in a society and caring for each other costs money, and we don't expect a return on that investment because the return on your investment is human life. Human life, it's unconditional. It is valuable regardless of how much labor it produces. I don't care if you're a productive member of society. If you are sick, I want to live in a country that takes care of you, regardless of your income level, regardless of how much money can be extracted from you by a corporation. So, point one is fuck you. Point two, the United States spends more money per capita on healthcare than any other nation. Last I checked, the figure was a little over $12,000 per year per person the United States spends on healthcare. For mediocre healthcare outcomes, the United States doesn't even rank top 10 for life expectancy. And that's really shocking when you look at the tremendous amount of resources and resource diversity this nation has. We have everything available to us to have longer health outcomes, better health outcomes, but instead we're spending more and getting less. And you have to ask, why the hell is that happening? How is the United States spending so much more than everyone else, but getting worse outcomes? Part of the answer is the United States has a distinguishing feature in its healthcare system. There is a middleman between you and your doctor. And the power of that middleman has grown exponentially since the 1960s and 1970s. We call that a for-profit health insurance company. This is a company who exists exclusively to make a profit. These companies do not exist to deliver superior healthcare outcomes to patients. That's a doctor's job. This company is a gatekeeper between you and your doctor, and they charge you a monthly premium. Sometimes they charge the government a bit of that premium. That's what an ACA premium subsidy was. And what happens there is you're paying them money, and then when you need the healthcare, you've been in an accident, you're sick, you can draw against that insurance, but they need to protect their bottom line. So what they're going to do is they're going to find any reason they can to deny coverage, to limit coverage, to maximize your deductible, make sure you're paying as much toward it as they can, or try to get a government subsidy to pay it so they don't have to. This is why we see so many people with terminal illness facing end-of-life care or the fight of their life, depending where they are, and their final days, which are supposed to be restful or, that we're trying to take care of these people, They are drowning in phone calls, meetings, paperwork, and debt. That is what the United States is doing to its sickest, most vulnerable people. And that absolutely balloons the cost of our healthcare because there is this unnecessary giant corporate bureaucracy between you and the person who exists to heal you. And this corporate bureaucracy, they exist for shareholder value. They don't care if you live or die. In fact, frankly, they prefer you die. They'd rather not have to deal with giving you any of that money. That is shareholder value. That is profits. That is bonuses. That is pumping their stock price. That's why people hate health insurance companies. And really, they should not exist. Now, if you go to Europe, which is where most of the developed nations that we compare our health insurance to and our healthcare system to, they do have private health insurance. You can get private healthcare if you want. That's available to you. But the government provides, in most European nations that are part of the Organization for Economic Coordination and Development, at least, they provide at least 90% of their populace with health insurance. And 90% is considered low. The OECD actually considers it concerning if less than 95% of the population is covered. That's what the European nations have been able to achieve, which is quite impressive. Now, the other counterpoint was, well, okay, you have broad healthcare coverage, you've covered a large amount of your populace, but what's the quality of that care? Without a profit incentive, is the quality going to be bad? What about research and development? Without a profit incentive, how do you do this? Honestly, those are fair questions. I'm going to put my fuck yous on the shelf, and I'm actually going to engage a little more intellectually now, because that's a good point. Couple of things. You have to remember that research and development is expensive, it's risky, it's time consuming. A CEO of a major health company who decides to embark on a research initiative is taking on tremendous risk. You do not know if that new drug or procedure that you are investing in will actually return a profit to you. You don't know that. And it could take a long time before you see any fruits from that labor. So it's high risk, it takes time. But CEOs in the United States who work for a for-profit health company, their loyalty, their fiduciary duty is not to patients. And I'm sorry to get lawyerly on you, but they owe no duty of loyalty to patients. The only legal duty of loyalty a healthcare CEO owes is to his shareholders. So CEOs are looking quarter to quarter. How do we get our earnings per share up? How do we maximize shareholder value? That is the true job of a healthcare CEO. So if you're a healthcare CEO and you're looking at, well, how do I increase our earnings? How do I maximize earnings per share? How do I maximize shareholder value? Option one, do I embark on very expensive, very risky, very time-consuming research that may not get me anywhere? Or option two, do I develop an AI algorithm to help me automatically deny claims and I can lay off a few thousand administrators? That way we've reduced overall costs, we've reduced the number of claims being distributed, we keep more money, we're spending less on payroll. I look fucking brilliant because risk-free, I've increased our earnings per share by reducing our costs. It sounds cynical, but frankly, that is what happens every quarter in the United States. That's why you see these big layoff announcements and this rush for AI. It is a lower risk, lower cost way to increase your profit margins without all the baggage that comes with research. Flip that on its head and look at single-payer government-funded healthcare. The government is not looking to make a profit. The government shouldn't be profitable. I mean, you want a balanced budget if you can have it, maybe a few surpluses here and there for a rainy day, but a government that's consistently profitable all the time, I call that a corrupt government. What the fuck is all that money doing? Instead, what we'd like to see is a system where the government takes risks. In fact, a lot of foundational technology we rely on today came from government research. Simple things. The glass we see on fighter jets, some of the adhesives we rely on, the technology for our smartphones. Sure, private enterprise took that torch and ran with it. That's why we have these things. But the foundational research, the stuff that makes those building blocks available, government research, military research, the kind of thing that doesn't really generate an income. These are curious minds trying to build a better life, build better materials for the American people. You don't need a profit incentive for that. You do have enough people. If you educate your populace, you have enough people who, if you pay them enough, if you give them enough, they are not necessarily motivated by, oh, how do I pump up the stock price of my company? That's not what they're looking for. They genuinely want the credit for the research. They want the thrill. There are people like this. They exist. I'm one of them. I've done research for no money. I've published peer-reviewed papers because I have a message I care about. I did the hard work. I put it out there. So that's my answer. The profit motive doesn't necessarily give you the best research, the best systems. And then finally, look, this bears repeating, fuck you. Because if we are going to have a system where whether or not you get healthcare is determined on how much labor you produce, that leaves out children, that leaves out the sick, the elderly, pregnant women. You're leaving out whole sections of your society, and you are basically telling them that they are worth less based on how much money they have. And that creates tremendous pressure on your workforce. That results in more call-outs because people are going to limp along, no matter how sick they are, until they cannot ignore it anymore. Or, like we saw in COVID, you have people catching contagious illnesses and going to the office, infecting your whole workforce when, man, they can't afford to see a doctor. They don't have health insurance, or they're scared of losing what they have, so they go to work anyway. None of this is any good for anybody. And if we're going to say, well, the United States, it has all these great healthcare programs, that's true. We do have some systems that are the envy of the world, but they're only accessible to the rich. It doesn't really matter to me if we have some of the best techniques, some of the best surgeons, some of the best hospitals, if they're only available to a very elite group of people. That stuff is behind a gigantic paywall. Now, I talked about the Organization of Economic Cooperation and Development, OECD nations. There's about 38 member states. Only 2 countries of that club are below 90% total healthcare coverage for their people. Mexico is one, dead last is the United States. Mexico is second to last, covers about 50% of its population, although they are improving. The United States also has been improving, 13%. And the OECD considers less than 90% problematic. And you can see just how catastrophically we are failing our people when you remember we pay more per capita than any other nation. So what do we do about this? That middleman has got to go. These for-profit healthcare companies, they produce nothing. They do not produce any value. They produce numbers on a spreadsheet for some stock market douchebag. They are interfering with patient outcomes. They are not delivering on anything. They do not profit when you are healthy. They do not have any incentive to work hard to help you get healthy. Their incentive is to keep you sick, keep you from getting benefits, charge you as much as possible. That is the system that we have set up in the United States. It is not a healthcare system. It is a sickness for profit system. And the only way we're going to see things get better in this country is if we discard these myths, this propaganda that the health insurance lobby has spent a lot of money on, that convinces otherwise intelligent people that universal healthcare, single-payer healthcare, a system that's proven to work in most of the developed world, is somehow a communist fantasy or a socialist hellscape. It is neither. It is the standard that most nations follow for a reason, and it is well past time the United States gets caught up with the rest of the world. Thank you very much for listening or watching. If you like this, you can subscribe for more. My Substack is free. If you want to throw a few grateful dollars at the program, I'm very blessed and very grateful you want to do that. But there is no perks to doing that. It is truly a free resource for everyone. You can also follow me on Instagram at Attorney Ryan. Thank you for listening, and let me know your thoughts below. If I missed an argument you think is important, or you think there's a hole in my logic, please ask. I want to hear what you all have to say. Thank you very much.